Hospitals across Nevada are feeling the strain of more COVID-19 patients requiring intensive and acute care. We have a look inside one ICU in northern Nevada. Kim Burrows reveals the harsh reality at St. Mary's Hospital in Reno, where people on ventilators are unconscious or struggling to survive.
Putting a chest tube in them.
This is ground zero, where the sickest COVID patients are struggling to breathe.
It's devastating.
Every patient here on some sort of oxygen, most on ventilators that are forcing air into their lungs. This is the ICU where staff took care of critically ill patients, but now it is just the COVID unit. There are 15 people here fighting for their lives. They're young and old. Several tubes, IVs, and monitors connected to each patient.
We have a ventilator on this side. This patient's a ventilator. As you can see, there's multiple IV pumps, multiple monitors, multiple things attached to these patients. Ventilator, artificial breathing, induced coma. All of these patients are very, very sick, requiring a lot of resources put into each and every patient.
On the December day we visited, St. Mary's had 65 COVID patients, and we're expanding to hold more.
We are planning, as capacity grows, as more patients come in, alternative care sites, such as this one, creating more critical care beds for these patients needing ventilators and just basic medical needs.
You have the beds. What about the staff?
The staff is where our community at large is struggling.
Staff are picking up extra shifts, working long hours, and then there's the emotional toll it's taking on them.
I was very pregnant at the start of this, so it was very scary. And it's continued to be scary, worrying if we're going to bring this home to our family and our children.
This is the emergency room. Staff are extremely busy treating COVID patients here, too.
It was scary at first when it hit up in March. Now we are, I'm going to say, threefold busier than we were in March. And I'm not scared because people need us, and I'm here for a reason.
Back in the COVID ICU.
These are long-term ventilated patients. It's not a quick virus that they recoup. It's a 4-week battle that goes on every day.
The message staff want you to hear as COVID cases surge.
Our community is Northern Nevada. We are here to, as a hospital society, to help you guys. I think it's your turn now to help us. We need help by following the mask mandate, by following the distancing, by being responsible in how we act to prevent more patients from coming into the hospital.
Sadly, some of these patients will not survive. The man down the hall is losing his battle.
We have a patient that's not doing too well, so we have most of our staff in there trying to help. 4 nurses, respiratory therapist, a physician, trying to save this patient. And these patients can turn on a whim. They may look fine right now, but in a matter of seconds, they could stop their breathing.
This unit closed off from the public. The patients isolated from their families. Staff can only FaceTime their loved ones for any kind of a connection. The threat of spreading the virus is just too great.
So these patients, when they are dying, they are alone.
A powerful look. That was Kim Burrows reporting. There's over 1,900 people hospitalized with COVID-19 in our state right now. According to the COVID-19 Tracking Project, Nevada has the highest hospitalization rate per capita in the U.S.